So anyway, I wanted to just have a chat with you,
Sure.
to see how
What happened.
what happened, of course. And the first thing that struck me, of course, before I did the video, criticizing your video, was that, and a lot of people said that all these guys are quack doctor, whatever. I have a feeling that you're not a quack doctor. You explained some of the concepts quite well actually in your video. When you took the whiteboard and you show how the vaccine works and all that. So just for the benefit of my viewers, like, what are your credentials and experience in medicine?
Okay, so I'm a medical doctor, Dr. Roland Victor, practice at the KL Sky Clinic. KL Sky Clinic is an integrative and medical clinic where we look into a lot of functional medicine approach. So not just behind the concept of consulting and treatment, we look beyond that. We look into the concept of a 360 medicine on a holistic approach in terms of lifestyle, exercise, diet. So it has to be seen as complete to what healthcare stands for. So we want to look at taking primary care to like the next level.
And of course, primary care in Malaysia is not as, developed as, in other countries like, say, Australia.
Certainly.
I know that in Malaysia, if you're a GP, people say, oh, you're just a GP. Where in fact, in other countries, family medicine is its own specialty.
Exactly.
You're specializing in generalities.
Correct. And in fact, when we look at a doctor's journey, sometimes we start with medical school, and then we end up in husbandship. I think Jason experienced, you yourself experienced.
Where did you do your husbandship?
I was in Teluk Intan, Perak. How about you?
PGH.
Okay.
Because I studied in Penang Medical School, Penang Medical College. Then we do our clinicals in Penang General Hospital. So I thought just continue, because it's a nice place to learn.
Understand.
Great place to learn. So obviously that whole video that you made went viral, and how did you? What was your experience? I have a feeling that it wasn't really pretty. And do you get a lot of feedback from your parents and or family members or friends? How did they react to it?
So I would say that, let me start where we start back again. So being a medical doctor, I have a master's in business administration, specializing in healthcare. And this takes me back to 2012-13, when I was in private healthcare facilities under the Ministry of Health, where we look into engaging private practitioners how to improve themselves, or making sure that legislation is in check in terms of the concept, the rules, the regulations. Like you mentioned about the doors earlier.
The doors, widen the doors.
I think we got to go beyond that. And during those years, I started realizing that if I leave the government, because I knew that if I were to continue my MO shape and go into orthopedics, which I was really keen, sports medicine, stuff it will be a journey. I probably turned out to be a decent surgeon, but I felt that I saw what the surgeons were going through. I mean, the clocking hours, getting the credits, working under another specialist, that 24 hours, 36 hours on calls and stuff like that. I realized that maybe there's something a bit much more spicy out there. That we can actually add that twist in healthcare, and then led me into a concept of, look, maybe this integrative approach or more holistic GP approach would be something that KL needs, or to be a fresh start.
So you founded the clinic.
Before leaving, I was already headhunted by all the GLC kind of hospitals, because I had those kind of ISO checks and everything kind of thing. They want someone who actually
knows,
understand the law, and understand they have the credential, they have this business rollout. When you go into private, as much as healthcare is a concern, there's also a business component to it. You cannot neglect that. And then I joined. I decided not to go into the big giant hospitals, but I picked up being in a practice of a polyclinic chain group. So they had about 13 branches, and now they're actually bought by GLC. And there I was in a practice, and in evenings, on weekends, I go into looking into doing all the audits, redesigning their concept, making sure that their supply chain is streamlined. Because I'm sure you have done locums at least once or twice. And you understand,
never
very
done.
good.
It's illegal to do locum. As a houseman.
No, I mean when you were MO.
Oh no, I'm too busy trying to do comedy. Right. So the question I initially asked. So when the video went viral, how did you react to the news and how it was on criticized on social media? And I'm sure your friends and colleagues will be concerned. What did they say when they reached out to you, and how did you this fallout must not have been easy or pleasant. I'm just assuming.
Understand. So I would say the reverse. I would say the reverse.
Yes.
I think the video was actually done live. It was not recorded. It's like uncut. So sometimes in uncut, sometimes you can be too emotional. You can be a bit strong in your context.
Right.
But
Okay.
The main idea is to get the message out.
Wait,
So
okay.
I felt that the real message was, we've been looking for weeks after weeks, waiting for when is the vaccine plan coming out, and I
Understandable.
see no idea until at that date. We don't have this planned tindakan vaksin kebangsaan and everything coming out, and then you start looking into what is being placed on the dockets of the MOH website itself. Then you look at side effects, kesan sampingan. So when you started looking into the kesan sampingan, of course you and I know that there's going to be some very, very low risk side effects.
As
For
with all
example,
medications,
exactly,
like
with all
Panadol, right?
Exactly. If you're looking at vaccines, you're definitely not going to have like arm swelling, fever, and that's part of the inflammatory reaction. We all know that.
Which is normal.
Yeah, which is normal.
Okay.
So when I went into the docket, I started realizing that limb swelling, 1 in 10,000 has a possibility of having palsy or facial drooping. That's like, how come this information is sort of like blancoed out of their docket?
Okay.
Because
But is it?
why?
Is that information available in the? Because you pulled out the Pfizer doc, right?
That document is actually released by KKM itself through NPRA,
Okay.
the National Regulating Pharmaceutical Agency. So the document is there, and that side effects, I even brought it if you want to see that.
Oh, so it means the side effects was displayed,
It's
but
not
in the
displayed.
KKM
Yeah.
for public consumption is not right.
So
Okay.
so my risk in terms of a professional viewpoint is like, look, if even though the data set at that point was maybe about 20,000 people on the third phase clinical trial had shown some effect, and the pharmaceutical company decided to still place it in the docket.
Okay.
And I felt that if we were not transparent enough to tell people like, look, there is some possibility
Yes.
of this. And trust me, if they give you a lampiran and say like to a makcik Kia out there, kesan-kesan sampingan, everything, you put Bell's palsy down there, 1 in 10,000, none of them would know what it means also.
Right.
So public wouldn't know. So I don't think, and I still believe, based on the feedback, I think we're going to have two feedback position. In my perspective.
Okay.
One perspective is going to be coming from the doctors. They're going to feel like, Roland's putting fear out there, and we are here all out. I think that's what even you felt.
But
Roland's going to put fear out there.
Yes.
That people are going to get scared taking the vaccine.
Okay.
There's one, because you only like zoom into one fragment of the thing. But the other side, if you look into the feed, I might be right, I might be wrong. So much of public support on. Thank you for at least telling us that these things are there. But again, this could be coming from the fan-sitters or coming from the people who are not pro-vaccine.
Yes.
We know that. We know that.
So the problem. Okay. So when but you okay, there are a lot of people on, let's say, Twitter who are
Not on Twitter. That's the problem.
Okay, yeah. But okay, on social media, they no, on Twitter, to be fair, they like to they have been scrutinizing and criticizing the vaccination rollout plan, of course, among other things that the government does, But when they do that, they don't come across as being anti-vaxxers or spreading fear. No, they criticize, but then it kind of stops there and they go, the criticism is correct. And if that was your goal and aim, which is, I feel that there was good intentions, there is like, hey, be more transparent. But how come, in your opinion, it became like the a lot of people in the medical fraternity saying, hey, this Dr. Roland is spreading fear. How did it go to that? Do you post-mortem it?
I think I know why. I think I know why.
Yeah.
I think if you see the people who are commenting,
Right.
are most likely physicians or surgeons or MOs. Okay, they are bogged down with work. I truly understand that because of the tight SOPs, the protocols,
Okay,
gowning,
so they are bogged down
PPE
with
and
work.
everything, and you have congestion with their whole operation system on choke. Delay of
Yes.
patients coming in,
Okay.
too much focus on making it certain non-COVID ward, COVID wards, COVID hospital,
Yes.
and all of that.
Right.
Yet to say that the public health also had a honeymoon period at a certain point of this year, which we should have like really get a game on in terms of we had a second wave or third
Understand?
wave or
Right.
fourth
Okay.
wave.
Okay. Right.
So I think they felt the stress of, or if this goes out, people don't choose to opt for vaccination, we're going to have more work.
But that's fair, right?
Yes, that's
because
fair. That's fair.
more COVID
That's
patients.
That's definitely fair.
Yeah.
I mean, none of the videos were actually enticed to not promote vaccination. I'm for the vaccine. In fact, I would say that.
So just to be very clear,
Yeah.
right? So you are
I'm pro-vaccine.
pro-vaccinate. And you would like people to take the vaccines.
In fact,
so that's a very important message.
In fact, like our clinic is one of the selected clinics in the city.
That is the irony, right? That is the irony.
to even have like yellow fever vaccination.
Yeah.
And people come to us to get this vaccination.
Okay.
So we, in no circumstances was like promoting. In fact, I would honestly say it is people like me who are going to get more people to vaccinate.
Yeah, you see the way he plugged his. Okay, so but here's the problem though. I think when you say things like when you say that you get more people to vaccinate, it does feel though that the net effect is you will get a lot more people who were fence-sitters and then they decided they watched a video of you very credibly speaking fluent Bahasa and English, explaining vaccines and you know saying all those things, and I think the net effect is there will be a lot more people who won't take the vaccines, and I'll tell you why. Because prior to your video, I mean this topic is very close to my heart, even though I'm no longer practicing. It's just that I have a lot of friends, not a lot, but more than that is comfortable, who are not comfortable taking the vaccines. They and all their misconceptions are there, and it's like I feel like even though I'm not in the practice, but I feel like I'm fighting an uphill battle, trying to convince them to take the vaccines. And that was before your video.
And you're right, no? Because even after that video, I honestly received at least close up to about 50 to 70 messages from doctors in the system itself, saying like, you know what, can we hold up? Can we just wait? I said, it's your choice. I cannot decide.
Yeah.
But
So you see that I think that video, the net effect is, unfortunately, it's gonna, you know,
that's why I call it the acid test.
Yeah, it's going to have fewer and fewer people who want to take the vaccine. I think that's a big problem. Now, in the very beginning, you mentioned that, you know, you said when you did the video, it was live and sometimes not scripted, and then you said that you sometimes can get emotional or whatever.
Yes.
Do you think at times, because it's not scripted, it's not live, it's not pre-recorded, it's live, were you too emotional at certain times? Were there things that you would have liked to do differently?
I think yes, of course. I think if I look back and say, okay, you know what, I should have done better in this perspective. I should have not said this in a better way. I would totally agree with that, but sometimes, you know, you feel that because you're also reading and answering the threads, right? Sometimes you can
Terpesong.
end up exactly terpesong, because they might ask you like an old discussion which you already had, and you just have to like reshare it back again. So that can actually take you off grid.
Yeah, the one thing that I do feel concerned about, and also actually on a personal note, also concerned for you actually, is that now the anti-vaxxer community in Malaysia, who they themselves are becoming very vocal and increasingly more organized, they have attached you to them. You get what I mean? Like you have become for now, like their champion, you know. And it's like when I was following the US politics news, and then there's, you know, QAnon. Are you familiar with QAnon?
Yeah, of course.
And QAnon is like this crazy conspiracy theory that has somehow gotten a lot of support. And then when Donald Trump doesn't disavow QAnon when he refused to, and in the beginning when he refused to say I don't believe in QAnon or whatever, they somehow make Donald Trump their avatar, like their champion.
I understand.
And now, because now if you visit several anti-vax Facebook groups or whatever, or even in WhatsApp groups, your name comes up, right? so are you concerned with that?
No, I'm not concerned with that. Again,
You're not concerned?
I'm not concerned with
Okay.
that. I think
Right.
I'm still pro-vaccine.
You're still pro-vaccine?
What I would say is, I think in a small country like Malaysia, we should not label our people as anti-vaccine. I feel that
Okay.
they just need more understanding of what's coming, and they just need to be assured. Even though I think Jason and you and I might agree that here the anti-vaccine sort of like agenda, if you call it, it's even more deeper because they will click religion to it.
Yes.
It makes it even harder. Because they will look into whether there's a porcine, bovine
yes.
ingredients.
Yes.
Because maybe in the States and all, you look into like, is there any toxic metals?
But here is whether there's animal products, right?
It's animal products.
Okay, so it's a deep anti-vaxxer.
That's a deep anti-vaxxer. So that's what, even when broadcasting, I kind of use national language because
Understand?
everybody gets it.
Yes.
Everybody gets it. I still feel that through awareness, not the hard way, in terms of like, go on. If you do not vaccinate, we cannot disallow you to move from point A to point B. I think that's pretty heavy on people. But I think we got to give them some space. We need to listen first. We cannot go on like public TV and say like, no, you're a prick if you. We know the importance. We know the objective of getting the herd immunity out. We want to get that. As fast as we can get that, we can get the economy running in full speed.
So this is you saying go and get vaccinated.
Yes.
But for those of you who are on the fence, here's some more information. There's more transparency.
I would say, I think based on the current speed of the rollout, I would say, I think every doctor, and you're going to have colleagues like that, I'm going to have colleagues like that, and
meaning who are
who
cautious.
say that, look, you're going to be extra cautious. And I would say, in that video, I'm just being extra cautious because I feel like 2 months or 20,000 data set on a third phase clinical trial, it's still too early to roll out. I know you mentioned like if certain ministers outside there, if they are taking the vaccine, whether it's honestly taking the vaccine or it's staged, I still feel that that's not a good measurement yet.
You mean the point I make where if it's good enough for
Exactly.
right, that's the one. If it's good enough for the President of the United States, good enough for Queen of England, good enough for Prime Minister of Singapore, it's good enough for us. So it's an inelegant argument, but you're saying that we need more time.
I just feel like I think you just need at least about 2 more months. 2 more months.
But don't we have already a lot of people being tested
tested? Yes.
The data and they have evaluated the side effects over the long. I mean, they've been following up with the patients over the long period of time.
No,
that's not enough.
No.
I mean, since they take the vaccine.
We have to see from the point of I think somewhere in the second week of November when the first vaccine was. They said they passed the third phase and it's approved. See, it's approved by FDA under certain emergency release point. And the same thing here. It's approved under NPRA under emergency listing.
And also Singapore.
So and most of the countries is gone in that way. So in terms of whether they have established enough data, we also don't know. Okay, but I think so far now I think close to about 180 million, maybe 200, maybe by the time this video comes out, people have already taken the vaccine. And we have seen.
Is that good enough? 180
very
million?
Good, very good.
So means
very good.
Enough data.
Yeah, exactly. So there's going to be a huge amount of data coming out as I said, it's going to be a huge amount of data coming out in the next 2 months. Phenomenal amount of data that can actually put a lot of trust into new technology, whether it's mRNA or DNA kind of a vaccine, and also coming alongside on trail the Indian vaccine, the Sinovac vaccine, which is using technically a bit of the old school way vaccines are designed.
Okay.
So you're going to get a lot of that, and I believe
All are good.
all is going to be significantly fantastic to work.
Okay.
Of course, you're going to see some side effects and
course.
stuff like that, and you're going to get videos coming here and there kind of thing. But then we got to stick to the science lah.
Right.
Still again.
So and the point that I also made in my video with yours is that there was one point which is I think like I said, it was the most dangerous part of the video.
I know.
When,
I know.
when you said daripada saya, okay, I do it in English. If I get COVID and I get ill for 2-3 days, I rather and it's quite surreal to say this again, but I rather get the COVID than simply take the vaccine.
Yes.
Right. So now.
Okay. What I meant.
I know your intentions were clear, but don't you think that this will make people go, if the doctor don't want to take the vaccine, if the doctor rather have COVID, then I don't want to take
I
vaccine.
think
You see what I mean?
I know exactly. I know what I honestly meant was,
Right.
if I do not get the vaccine today, and if I get infected, I will succumb to it lah.
Succumb to it means what?
Succumb to the virus.
Wait. So
Okay,
wait.
Repeat that again.
You're saying if you
Say
get
example, okay,
if you
there's
get
a
COVID
vaccine,
today,
there's a vaccine,
there's a vaccine. Okay.
and I still am not confident for the vaccine today.
Okay.
And if I get infected,
If
by
you get
chance,
COVID,
by
okay.
chance get COVID, fine lah. I'll just live with that lah. I cannot gamble with something I don't trust. I understand the virus more than the vaccine now.
Right. So that is the. Wait, but
I
then
know.
you cannot say succumb. Succumb means you die from the.
Exactly.
You know. So and if you succumb means that's bad lah. So if you rather get if you get COVID, you rather that than the vaccine. Now when you say it in a video, you know,
Like, I would not take it like that.
yeah, because it looks like, given a choice, Dr. Roland Victor
Will choose the virus over the vaccine.
will choose the virus over the vaccine. No, so you don't mean that.
No, I don't mean that.
Okay, so then let me just be clear. What you mean
That is crazy.
no, that is crazy. Right, that is crazy. Okay, so what you mean is, there's vaccine now.
Yep.
You're not sure about the vaccine.
Yes.
So you
I
won't-
understand the risk factors that the virus can give me, and I'm also confident with my status of my immunity.
Right.
Okay, that's very important. That's very, very important today.
Okay. So it means you know your immunity system, you know the risk of the vaccine, and you know the risk of whatever happens with COVID.
Yep.
And if you are given a choice now, I can give you vaccine, or COVID is going to infect you. You rather get COVID.
I mean, I'm still not convinced today. Give me, as I said, give another few more weeks or a month or two. We're going to get so significant.
Yeah,
amount of so I'm doing this already.
I know. So you see, there we were circling back to the major problem, which is, if you say these kind of things,
I know, of course.
people won't take the vaccine, which is contra to what you said before, which is you're pro-vaccine.
Yep.
It's contra.
I think that's
contradictory.
Technically, on a personal perspective, I see that position, because I'm not ready for something that I'm not convinced yet. That's all. I think people have to respect that, and
okay.
we're going to see that outside that. Maybe, what if I had autoimmune issues?
Okay.
And would you tell me to take the vaccine, or you know what?
Well,
Practice social distancing, practice the safety until we have enough of data that.
I think the CDC or the CDA has said that people who have some immunosuppressed conditions, they can still take the vaccine, according to the CDC.
I think they're gonna be patient with that still.
But it's already out on the website.
Yes,
Yeah. Sorry.
Sorry, why?
It's not live, by the way. It's not live.
Okay.
It's okay. It's not live. It's pre-recorded.
I think I just put it there, can?
Okay.
Yep.
Okay. Okay. I'll circle back to that later. So I just want to. So another thing that
want to get me right.
No. No. This just okay. The reason why I just don't want to get you is because like I said, I'm a stand-up comedian now, so no longer practicing. But this topic is to me is very important, and
I think it's super important.
Yeah.
Too.
So
I feel there's a lot of segments that has been neglected in this whole pandemic journey. especially in terms of
There was a Instagram post of you made on the 21st of December.
pandemic is a hoax.
Yeah, the pandemic is a hoax. Now, see that again, it's such a mind-blowing thing to come from a doctor, like a medical. So, how do you defend that position?
I still defend it.
So the pandemic is a hoax. There's no pandemic.
No, there is a virus, but there's no pandemic.
So the definition of pandemic,
Trust me.
My layman
Okay, go.
definition of pandemic is an epidemic in all the countries around the world. So now you're asking me to trust you that there is no pandemic.
I would say that you could go on with this definition today.
Okay.
Maybe 50 years from now, I might be right. That's
50 years. 50 years from now. But in the interim, there'll be many millions dying.
Then they can follow the WHO protocols. I respect their protocol.
But that's too much of a gamble, Dr. Roland.
That is.
Okay,
No,
so why is it not a pandemic? So you're saying there's no pandemic?
There is the virus.
There is the virus. Okay,
There's
okay.
infection. But I still feel that they could have managed this in a way better way.
No, wait. So the management of the pandemic is a different thing. So you are saying this pandemic is the greatest hoax of the 21st century. So when you say it's a hoax, you are saying that the pandemic is manufactured, or or there's no pandemic, or
It's still too early to put the puzzle. There's so many trails towards this because we do not see. Even WHO has poor access into Wuhan at the moment. You and I know that. They're not getting a lot of information out.
Okay.
We do not know whether this is it could be a bio war.
Okay, but
it could be a bio war.
But isn't there enough information to say that if I do the PCR test now, there is a COVID-19 virus in this many hundreds and thousands of people in Malaysia. Then you duplicate that in Singapore, in countries all around the world. So isn't that enough to say that there is a pandemic?
Then there's other kinds of viruses. There's so many other things. There's flu. There's so many things. Even AIDS is a pandemic. But how much have we done? Did we stop?
Well, nowadays people with HIV can live a lot longer than before, and there's a paradigm
because of the
shift
medication
of medication. Yeah, so that's what we have done.
And provide protection and everything. But I feel
because also AIDS, we have like decades of research.
Yes.
COVID-19 is new,
but we still haven't found a straightforward cure. We are still pushing or delaying.
But there are so many diseases we don't have a cure. What?
Exactly.
Diabetes,
of course. No,
cancer.
There is cure for diabetes. I think it's your own initiation of food, lifestyle, and stuff.
Okay, but there's no drug to cure diabetes or cancer. There's no cure. No cure for most cancer. So maybe. Wow. Okay. So sorry, I want to unpack this discussion because to me it's fascinating.
50 years from now, huh?
Okay. Wait. No, how I'm going to die. So so you're saying there is an infection, there is the virus. So if I were to interpret your IG post, there is a pandemic lah. Or are you saying the pandemic is mismanaged, or there is no pandemic? There's two different things.
There is a virus, but there's not a pandemic.
But pandemic means the whole world.
I know the whole world. The whole world has diabetes. The whole world has obesity.
Yeah, these are all pandemics.
Yeah, exactly. So,
yes.
So,
okay,
I think the biggest thing is the fear.
I just about to say. So you're saying we shouldn't panic over the.
Yes, we shouldn't panic. I think a lot of governments, whether yes or no, are using this as a massive opportunity. We would not know under their own OSAs and stuff like that.
Interesting. So you're saying that all this is so fascinating. So you're saying that all the
I'm not being conspiring anything.
This is a conspiracy theory.
Like I said, 50 years from now, you would see that. Okay, if you say that this is conspiring towards a concept or a theory, an idea. Okay.
No, I'm saying that it is mind-boggling to think that all the countries in all around the world, together with their politicians and their scientists, healthcare workers, have conspired.
I wouldn't say the healthcare workers.
Okay, fine. Fine. So the politicians
have their own agenda. We do not know what the agenda is. Maybe it's good.
Okay. Do you know, like, it's so hard for governments in, let's say, in Malaysia to coordinate amongst themselves. But you're saying that Malaysia government can coordinate with Russia, with China, with India, all these people to create this pandemic?
No, they're not creating the pandemic. I said they are using the pandemic as their best interest.
Okay.
Because I would see if you look at the way US had no case last year, I think as of like February,
Okay.
and now they have the highest number of deaths. Like, don't tell me like the CIA or the FBI, they don't have like any special intelligence like to really like go and say, look,
Well,
they could get
okay.
like calculated.
Okay, so
let's leave the president aside.
no. Okay, US no infection. Then after they got cases because the virus spread long, and that's why it's so scary.
Then if you look at epicenter places like China, look at the number of cases they have today. Are you
It's very
saying
low.
that? Yeah. Are you saying
But
that?
they went through a very, very hard lockdown. And
Yeah.
China is so authoritarian that they can, with one stroke of a pen, shut down everything, which will stop the virus. And now they have no cases.
Which and on another perspective, if you're looking at like world geopolitics at that point,
Okay.
has a certain issue we have to also factor in, because we left one country in the world, I would honestly say, control supply chain and production.
Sorry,
Which is China. One country in the world manufacturing. Technically, the world's manufacturer. I will give it to China.
But it's not the only manufacturer.
Yeah, the only manufacturer. But
not the only.
Yeah,
right?
but you see, that when it happened in like early January, February, March, you could see the whole world's supply chain get disrupted.
Okay. And, okay. So if this is a
It's not a conspiracy.
it's not a conspiracy. Okay.
It's something.
It's something that China has used it to their advantage.
You can see
And what is China's game?
I don't know.
Now?
I don't know.
So
I don't know.
You don't know
I
the game,
know.
but you think
We have to watch. It's actually, we have to watch.
it's like you have written the first part of you've written the first part of the movie.
I have.
You have not figured out the third part of the movie yet.
It's gonna take some time.
Okay, so despite all this, you say there's no pandemic, but you are still pro-vaccine, pro vaccination.
Because you have a problem, you have to fix it now.
So and the way to fix this thing is vaccination.
Technically, the antivirus.
No, antivirus is the drug.
Yeah, sorry. Technically, the vaccine is going to create the immunity.
Right. Okay.
Right.
Just to change the tone a little bit. So I understand that there is a police report made against you. I know that's. Well, I have never had a police report made against you, but I know some friends who have had police reports made, and I'm sure it's a harrowing experience. If you can talk about your experience with the police report?
I think
You went to Balai?
it was a very decent experience. I've experienced that before during my enforcement years.
Yeah, why am I not surprised, Dr. Roland? Okay, what happened in this case?
So I think I can't expose much of
course,
what happened.
were they okay? Were they
Yeah, it's
decent?
very, very decent,
Right.
very professional, because I had the numbers and figures that they wanted to see, based on where the sources of I got this information from.
Or what? The dockets like that you showed.
So I had to
okay.
give the dockets, and they cross-checked the dockets, and they were pretty fine with that. And they said, if we've got any more things, we will get back to you. But they took my phone.
Yeah, you have to make it. You have to get a new
Exactly.
phone.
The phone used to record was
I
taken.
see. The device that they're recording on.
Exactly, because under the I think the Suruhanjaya Komunikasi and
Whatever,
Multimedia Act,
Right.
So they will look into the devices we used to record. Other than that, I think it's pretty okay. But I was a bit amazed that there was so much of media outside. I was shocked, like, what?
Yeah. That's what happens when you make that video go viral.
I didn't intend.
I know.
Intend.
The best viral videos are not intended to go viral.
Exactly.
Ironically, we're using the term viral
Yeah.
because we're talking about COVID-19.
Because I usually go online with my patients or followers, like usually like maybe a week once or twice.
Right.
Once the kids are asleep, go online. Usually we have like certain educational content, but most of the time our focus content is in regards to what we do in our own practice. But these things are of course like out of like national interest,
National service.
public
National-
concern, or
right.
what's going on. The patients will know what's going on. So you have to also give your perspective. If you are the doctor, okay, what's the perspective? Am I going to ask you to wait? Am I going to say, okay, go?
There's another part of the video where it was also concerning, where you said that somewhere along the lines, towards the third of your video. By the way, I watched your video 5 times because when I edit, I have to watch it again and again and again. You know what I mean?
I think I never watched the video.
Yeah, I watched it 5 times again. So, so the part where you say like
The numbers, is it?
yes, the numbers where
Okay,
I
this
can't
one-
remember the exact words, but you said something along the lines of so the numbers that you made
Don't
up,
match.
or rather now you cannot cover.
Yep.
So again, I think that is a serious allegation.
Okay, I would say
Wha- wha-
not. I would say not. Okay, this
Not means what? Not.
I would say the numbers don't match the
Oh, okay,
decisions.
so-
okay, this is technically my expertise lah.
Right. Okay. So
this
you're
is-
going to say the
this
numbers
is-
don't add up, right?
Okay, so we know that in a certain situation, in terms of an emergency position, whether we announce the Darurat or PKP, is considered as an emergency situation.
Yes.
Okay, we had the first one sort of like in March, April, and then we started to like cool off.
I mean last year.
Yeah, May, April,
The first MCO.
May,
Last year.
June, yeah, first MCO 1.0.
Right.
You had a cool off right up to like September like that, and then
Numbers dropped.
then you had an election in Sabah.
Numbers went
See,
up.
Okay, numbers went up. See, everyone has to agree that the decision
What decision? Sorry.
to have the election.
Okay.
Okay, whether it's right or wrong, I cannot comment on. But honestly, I would say that there was an unwise decision.
Okay.
Okay,
Okay.
because once you have an election,
Mm-hmm.
okay, we must know that there were a lot of people from Peninsula moving out,
Okay.
in and out. See, when you dissolve the state assembly, there's a lot of election machinery goes out.
Okay.
Nobody's looking at that. And then
Election machinery.
all this gentra,
Oh, okay.
talking about people, talking about funds,
Yes,
talking
okay.
about
They go out to-
whatever,
they go out and mix,
campaign,
okay.
to campaign. So the window period was pretty long. I think it was quite long.
campaigning period.
The campaigning period is short, but the time that they dissolve
They-
and
they-
decide
they-
to
they-
have the election,
They kerahkan the gentra.
exactly. So there's a lot of movement going on already at that.
Right. Okay.
So we didn't see that build up. So one, and let Sabah to have a surge of cases, and then transmission back here,
Okay.
and that's when October.
Wait. So what's the problem in this?
okay, the problem
story?
comes back now. First, again, policy making. When you had the honeymoon time in Peninsular Malaysia,
Okay.
we never step up,
Consolidated our position.
plan strategy in
Okay.
terms of what's
Okay.
going to get hit.
I understand. So
Okay.
then
So-
election happened.
Election happened, and then you had the surge of cases in
Okay.
like November, December, January. Yesterday,
Right.
I think the numbers dropped below 2,000. I think.
2007,
I wonder what's
2009.
today.
Okay. Right. So
So
Sabah
coming back to the
election.
numbers, coming back to the
Yes.
numbers
Yes.
now.
So Sabah
You want-
election.
Yes.
Okay. Then
Then
numbers
coming
went
into
up.
January, okay, we get
This January.
Yeah, we get this feel like, oh, we need to introduce the PKP back.
Okay.
2.0. Okay.
Okay.
So at that point, announcing the PKP, the numbers was so low.
How much?
I mean, I wouldn't
How
say
many?
so low lah. 100. Must go and check the data lah.
Okay,
But
okay, okay.
190 something. But
Right.
it sort of like increased by 60%, 70%.
Right.
So even at a day before the video number, which I mentioned,
Okay.
the ICU usage was almost 60%
I
up.
understand.
People on ventilators were almost double.
Okay.
But you were easing out
The restrictions.
Restrictions.
Right.
So, what were you doing? If you felt telling us like, oh, our healthcare system is going to collapse, I would like quote like, oh, healthcare in hub.
And that's why we need the Darurat.
yeah, and that's why you need no, not Darurat. We need the PKP first.
All right. Okay.
Okay. So it didn't make sense because
Okay.
we did not source out Klang Valley's amount of private practices, doctors, and everything.
to help. Okay, I understand.
Yeah. So
Okay.
if you're looking into the strategical plan, back in May, June, July itself, public healthcare should already come in and look who's going to go in. And I would tell Jason that almost 70% of private hospitals in Klang Valley are technically government or state owned.
Okay.
So it's not hard for them to actually go in and ask them that, look, we need to use, this is ours, this is our people.
Okay.
We need to move maybe patients, get more space.
So you're saying there's no need for a Darurat to achieve that?
There's no need
Okay.
for PKP.
Right.
Darurat comes
Understand.
under the president of the king, so we
Okay.
don't want to comment on that.
Oh, or the PKP. Okay. So I understand.
PKP.
Yes. Okay.
Yeah. So if those numbers were actually managed. We can actually cope up with the capacity, and even going into home quarantine and everything. We've already seen the practice of home quarantine elsewhere out there
in UK.
and you could have done the same thing.
But home quarantine is not the best way, right? Because
it's not the
you,
best
you don't
way,
control
but
them.
see, but you could get your private practitioners. You can got help from a lot of the periphery system because you were
So that you
bogging
don't
down
have to do home quarantine.
Exactly. No, you can you can do home quarantine. You can actually lease out all those strapping and everything. Get the assistance of people. See, we can actually pay
Understand?
private to get
Okay.
it. Eh?
So what I'm hearing is KKM authorities did do a good job managing the
In the hospital. Yeah,
numbers and also the political decisions were not made with thinking about people lah, right? So that I get what you're trying to say, but in the video you said it felt like you were saying the data was made up and now KKM cannot cover their numbers.
No. What I mean is the data
Yeah.
is not made up. They're not covering the numbers properly. That means you are making the decisions and easing or allowing the people to move, but still having the numbers that are the numbers are going up.
Okay, so the problem is in that video, it really I watched it 5 times. It sounded like KKM is fudging the numbers, and now they cannot cover the numbers.
No, I don't know whether KKM can cover the numbers because
so
the
KKM is not covering up. KKM is not fudging up the numbers.
I don't know. I hope not.
Okay.
I hope not. Okay. I think whatever people are in ICU and ventilators are pretty definitely legit lah.
Okay.
Definitely legit.
Now,
I have friends working in ICU. I have friends working in all those kind of wards.
So then there's one sentence you say, sekarang sistem kesihatan kita nampak okay. Now, so you're saying now we got a lot of cases, but our system kesihatan.
So, but because you make it look like it's okay, because you're easing out all of the system. You're letting people go out and eat, travel around these areas. You've already longgarkan all of the. So I felt what I really felt.
Okay. So you're saying that the system kesihatan is not over congested.
The health system never collapsed.
No, but is it congested?
It's not congested because you have to take the perspective of congestion of did we max out everything or not? We never maxed out everything yet.
What about, say, cases in the story that came out from Kuching, Sarawak, where the hospital was like overburdened and the doctors were overworked, and you can hear, you read of anecdotes or anonymous sources from the doctors themselves because they are afraid of speaking out. They say that it's bad in the hospital in Sarawak. I can't remember which hospital it was. So if when you hear this kind of stories, and also my own actual friends who say that hey, there's a lot of cases now, it's bad, ICU beds are not enough, whatever. So that doesn't jive, that story in many people's heads does not jive with Dr. Roland saying, sistem kesihatan kita nampak okay. You get what I mean? Because you say, although cases have risen, our healthcare system is fine. But from the perspective of the soldiers in the battlefield, it's not.
Yeah. I again say that because we never used everything yet. We never used the private healthcare, even 10% or 20% at that point.
Okay, but now?
It's just slowly. It's late. It's slow. I mean, like even from the point of like, let's just say in the next few months, we knew the vaccines were purchased like maybe end of November, December, thing around that, and we knew that it was only going to come in like in February, where like certain countries got it just before Christmas or after Christmas. So there's a late purchase on that, and the rolling out of support. That means like, okay, can we get private hospitals in charge? That means like you ease out certain wards, get certain surgical procedures done in the private hospitals. For example, like you offload your ICUs.
You decanter.
Yes.
Yeah, okay.
You offload them, decant them, move pediatric surgery, move the basic surgeries they need, move them out into private hospitals. See, until today, private hospitals are like sort of only forced to treat category 1 and category 2. Instead of moving them to handle category 1 and category 2, rather just get those centers to actually treat, because some centers, for example, there's some cardiac centers, for example IJN or CBS, could handle so much of cardiothoracic surgeries. They have the
Wait, say
capacity.
again, so IGN can handle a lot more.
They can handle cardiac surgeries,
Okay.
and maybe get more space in places like Hospital Serdang, move patients
So
to
from
this kind of
move
center.
from patients from hospital
Government
Serdang
hospitals to move them
to IGN.
yeah.
But so
This is a crisis, you got to understand.
Yeah, but my friends in IGN would say we are already overworked. How are we going to do?
I don't
more
think so.
cases?
The stats from the private hospitals say that they have lost sales up to 70% last year.
Sales doesn't, but that also does not mean sales as in people coming in for consultation, or sales as in
Everything,
people buying
technically.
the time from the OT to do their private procedures.
Vice versa. It
Both.
could be both. It could be drop in sales, could be drop in patients, until maybe their financial reports comes up, maybe middle of this year, then we can see. But that's what they generally said. They've already lost a lot of patients coming in. And even if you look at, I would say this lah. Even there was, per queso and all, they were rolling out for people to do screenings and stuff like that for PCR or RTK testing at the moment. Not every clinic is given a chance.
Right.
It's super selected. Selected.
So I understand the concerns. I think there is
There is a lot
There is a
room
lot.
for improvement.
Of course,
So much to improve.
We have not, it's hard to do a perfect job. Of course, it's the first time we have experienced such a.
But I don't blame the clinical guys. They cannot dictate this.
Yeah, no one
the
is
ones
blaming
the ones who are sitting in the hospital, in the PKD, in the clinics, I'm sorry. This goes up to absolute higher management.
Okay, now I remember, of course, don't drink I swam just to. So this
bring the air batu now.
This is the first time Malaysia has gone through, I think, such a pandemic, right? Which brings me back to the biggest mind-blowing statement, which I am trying to grab my head around it. I'm not
50 years from now,
healthcare expert, right? But so this pandemic is the greatest hoax of the 21st century. So so when you say, well, China had a lot of issues and then suddenly got pandemic, it's beneficial to them. And then other countries are somehow using this to their benefit. And then you say in Malaysia, Malaysia is also, we ourselves are, we suddenly we want the PKP, then the numbers rise up, that kind of stuff. So can't this all be attributed to a coincidence? And the reason why coincidence is a big important word is because a lot of people don't grasp this concept, which is correlation is not causation.
Yes.
If A happens same time as B, doesn't mean A causes B.
Correct.
So just because something happens in, China has some geopolitical interests, which serves them when roughly the same time there was they call it the Wuhan virus outbreak, or in Malaysia where our political situation is not fluid, and then suddenly with this virus somehow they managed to tamp down opposition. It can all be attributed to coincidence, and if you don't have the proof to say A caused B, we can't say that we can't say that this is a hoax, because you're only giving me half of the equation. You are not giving me the full equation. You get what I mean?
Yeah.
So if you don't have the full equation, if you don't have the A arrow has caused B, then how come, I'm trying to understand it, how come you feel so confident in saying on Instagram, this pandemic is the greatest hoax? How come? Because if you agree that you have half the equation, how do you confidently say I have the whole equation?
I feel the equation can never be placed into a mathematical calculation on this.
No, I'm just saying figuratively.
Exactly,
I'm trying to reach out to the audience.
It's going to be very hard.
Yeah, but how? Because you don't have the proof yet. You get what I mean?
I will not have the proof. I will not have the proof.
So
but I have to
wait for 50 years. Okay.
Wait. I mean, do you know, 300 years ago, scientists thought the world was flat.
Understand? And then
how many people got killed for that?
Yes, a lot. Right?
Exactly.
Yeah.
And imagine that if you take to that position, we would think this is crazy.
So science, that's my favorite subject. So scientists thought the world was it? No. Actually, no.
Lesser than that.
No, according to history, thousands of years ago, like the story of Aristophanes, he actually kind of figured out that the Earth was a sphere. Because if Aristophanes, there's a video on YouTube by Carl Sagan.
Okay.
He saw that in the length of the shadow at his place is different from the length of a shadow at another town, about 800
Like a
kilometers.
Pythagoras kind of
Yeah,
theory.
800 kilometers away at the same time, which is noon. So during noon time, they thought if the sun is above, why the shadow should be the same length, but it's different length. Then he hired a man to walk and pace, and then he said, oh, among this pace, after this length of time, length of space, the shadow reduced by this much. Okay, and that can only be achieved if the whole sphere, the whole world is part of a sphere. The Earth is a sphere, and not only that, he figured out that Earth was a sphere. He kind of calculated roughly the circumference of Earth, based on that calculation. So now, if you take your argument that scientists thought that the Earth was flat, but since then, scientists have gotten the proof that Earth is not flat.
Yes.
So, because you see, I mean, we know when
I would say, let's fix this straight.
So see, as a comedian, I understand that I get a lot of leeway. On stage I can say shit. I don't have to back my facts up, But actually, because when I do jokes which are a bit factual, I have to back it up. And scientists and doctors, when they issue a statement, they always kind of hedge their bets, meaning they don't completely say A is B. They will always say A may be B if it follows this certain criteria with certain assumptions. Like if you read all these medical journals at the or research papers, at the end they say conclusion. According to this data, we believe that so and so is the conclusion, but based on certain assumptions, this drug may not work in patients with this condition, whatever. So they hedge their bets, right? So you as a doctor, you go on Instagram.
I think that's the problem. I think people should not always entitle us. I think we should be given to be taken out box. We should
elaborate.
Yeah.
Elaborate.
I would say like, what if this is a political science statement? Is that okay? Because it's not a scientific statement. Because we cannot put guns and medicines together like that and say, oh look, we need A and B together to work. No.
Okay. So
I think I would say that is much more of a political science
So you're
statement.
saying that
this is in the future we'll look at it.
So you're saying
if I'm wrong, I'm wrong.
So you're saying that you should be okay, I'm going to say it as crudely as possible. You correct me. Doctors should be allowed to say. Doctors should be allowed to make mistakes on social media. Is that what you're trying to say?
No.
Or your words as a doctor should not be taken at face value.
Yeah. People need to think.
So
you should not be too entitled to yourself. I feel like putting that statement. Oh, doctors. No. You allowed to crack jokes
as a comedian.
Yeah, exactly. But I would still feel I'm still a person. I have still so many other perspectives. Example, like if you want to take like religion to perspective,
okay.
Would you want to like back religion with science?
Well, yeah. I mean, see. There are a lot of comedians out there who they make jokes about religion, yes, and then they back it up by saying, look, but they back it up in a very funny way, okay, in a way. So, but. What I'm trying to say is, as your friend now, is that if you put on Instagram, the pandemic is the greatest hoax, and then we've been through a discussion or whatever, it's a very heavy thing to say, especially if you attach your name, Dr. Roland, there, because you see, and
perhaps maybe I'm not the only doctor who thinks like that.
I understand.
There are thousands of them out there.
Really?
Yeah.
Thousands
of them out there.
Doctors who think that is the greatest hoax. Thousands.
Maybe not the hoax.
But no, thousands may have different opinions.
Yes, exactly.
From the mainstream.
Yeah.
See, that's okay, but the statement very strong. I feel.
Okay, let it be strong.
Let it be strong.
Let it be strong.
You will. That is the hill you will die on.
Exactly.
You are gonna stand. Okay.
I'm gonna.
It's a huge bet, no?
Okay.
It's a huge bet, and also it's a bet you can't win so soon because, like you said,
Exactly.
you need to
Yeah,
wait for 50 years. Okay.
Maybe the statement was actually from the future, lah.
For the future. Okay. We're going to wrap this up very quickly. Okay. So I thought that instead of having just a video where we bicker back and forth, I want to make something positive out of this. Okay. And I was wondering if you and I together can debunk some of the myths about vaccinations that are that is almost commonplace nowadays.
Yep. Sure.
Okay. So I copied them down here.
Wow.
Together we can do this together, okay? But if you don't, again, if you don't agree, you wanna say it's a hoax, man, dude. That is, I hope you don't. But okay, so let's say some myths, okay? We'll debunk them together, okay? Okay, we do the first one.
Shoot.
This is like a
Sorry.
big floating ball. You just take the bat and hit it out of the park, okay?
Okay.
It's a low hanging fruit. Okay, vaccines cause autism.
No. You cannot say it doesn't. It causes autism. I think there's more to understand on what happens on a kid who gets autism. There are people who get into these spectrums for so many reasons.
Yes. The reason why I bring this up also because on a personal note, I have friends with children with autism, and that's in and of itself sad. But they have told me that because they are part of the Facebook support group for parents with.
But I think more of the concern is not about the vaccine, but in terms of the heavy metals that are present. I think that's the concern.
So that was the
that's
whole
the
argument, right?
Yeah.
But since then the heavy metals have been taken out, and also the heavy metals actually, in its own concentration, is slightly less than the amount of heavy metals you will find in the average fish, or even fruit. So I think that was again, Andrew Wakefield.
I have an experience about vaccination with my own son.
Oh, okay. That's you don't want to share this bit?
No, I would want to share.
Okay. So
he was my second son was about 3 months old.
Okay. Which year was this?
This is in 2017.
Okay, 4 years ago. Okay.
4 years ago.
Okay, 3 years old.
3 months. 3 months. 3
okay.
months old, and he started developing a big boil on his left, almost around the sternocleidoid muscle area. And look, it looks like it's like a boil. And
okay.
it was about this big.
Okay.
Technically about 4 centimeters.
Okay, 4 centimeters.
And
4 cm on a 3-month-old baby is quite big.
Significant.
Yeah,
So it's about this big. And I was like, oh, what's this? Like both of myself, my wife and myself are medical people.
Yes.
She's a pharmacist. So like, oh,
what is this?
Is this like an enlarged lymph node? We're thinking about Hodgkin's, not Hodgkin's lymphoma and stuff like that. You go around lah. Ultrasound scan, this, that, watching his temperature day in, day out, and you also do visit certain specialists, pediatricians.
Okay,
So like, let's do a surgery lah.
Yeah.
And you were like, hey, you know what?
Okay.
Wait lah, can we just wait a bit now?
Okay.
Can we see what develops now?
Okay.
Ultrasound doesn't find anything.
Okay.
We want to put for a CT scan. Then no. Then finally, we managed to see one of the head pediatric surgeon consultants in KL, and it was very nice. After his ward rounds, he said like, I think this is a slightly disposition BCG injection, which drained, supposed to be to drain into his axillary cavity, but drained into his subclavian lymph node, and
so wait, you from the
drainage
deltoid?
Yeah. Maybe they said most likely the staff nurse would have injected maybe slightly higher, which I don't think.
They don't inject in the butt, 3 months old.
No lah.
Okay. So some right?
Maybe at birth.
Okay. So then
drain, so then it expanded about 1 month.
Okay.
Really like enlarged, and it just oozed out. But for us it's like fine. But he still continued all his vaccination, completed, even took the chicken pox and everything. So,
that's great. Yeah.
But I felt like, what if this happened to
a non-doctor?
How would they react?
Yes.
How would they react? Because I would say that 2 months was a bit traumatic to us. It's like watching and seeing, is it expanding or not? Is there any spread?
But you still, thanks to your medical background, you did not succumb to.
Yeah, exactly.
So I'm glad your baby is well now. Okay.
Yeah, he's fine.
No TB.
He's
right?
fine, nothing.
Okay. So vaccines don't cause autism, right? This has been debunked many times. There are thousands of videos who will tell you otherwise.
But we need to look into the toxic metal lah. That's the thing.
Okay, but vaccines don't cause autism. Okay. So by the way, I know I sound like I'm being paid by the pharma companies. Trust me, I'm paid zero. I'm losing money on this podcast. These guys are so expensive. Okay, vaccines. Okay, another easy one. Okay, vaccines will install a microchip in your brain so Bill Gates can see your thoughts.
No, that's crazy.
Oh, so that's crazy. But pandemic is a hoax. No, that one
We
that's
don't.
a thinker. That's a real thinker.
We don't have the technology yet to include microchips
Right.
that far.
But when there is the technology, then you will have another video and saying, okay,
Maybe.
okay, the vaccines aren't safe because they were developed too quickly.
I wouldn't say the vaccines are unsafe. I think they are clinically being tested. I think as we get more data in the next couple of months, I think people are going to be way confident.
Would the vaccines, particularly with the mRNA vaccine new technology, would they develop too quickly, you think?
I don't think they were developed too quickly. I think the technology already exists. We understand the technology of
That's
even
great.
CAR T cells, where you can actually you can actually design certain white blood cells to actually attack certain cancer cells. So these are done. In fact, it's done in Malaysia.
New tech.
Yeah. So in terms of using a different technological approach, I think scientists can do that.
Okay. Okay. You can get COVID-19 from the vaccines.
No way.
No way.
No way. No way.
Okay.
Unless there was a malfunction in the manufacturing.
Where they put the COVID-19.
Specified vaccine.
Right. So yeah, so I mean this is demonstrably false.
You cannot get because most of the technology either using mRNA, adenovirus, specified,
deactivated or portion of it.
Exactly. So all of these are either going to be synthetic or manufactured in the lab.
So you cannot get
Tak ada
COVID.
chance, no chance.
Tak ada chance. Sorry, no. He said tak ada chance. But pandemic hoax got chance 50 years from now. Sorry, I'm gonna do a podcast 50 years from now.
You got that.
Okay. I've already had COVID-19, so I don't need to get vaccinated.
This is hard. We have to also look in terms of how good the immunity build-up is. Post-infection, I mean, if you're infected.
I think there are studies that show that you get some immunity, but it's very short term.
Yeah, exactly. Because I would use a very simple analogy. Maybe I will share this. You got this lah on your show lah. I give it to you
Oh, okay.
So, vaccination, I would put it in a simple form. It's like this lah. I give you this new technology weapon, and you are a military officer.
Okay.
And then you get the gun. You start playing with the gun. Shoot some free fire.
Okay.
That is your first dose.
Okay.
The second dose, I take you to the shooting range.
Okay.
And then you are this elite Rambo lah.
Yes.
You go around, tang, you tembak everybody. So
Okay.
that's when you get the practice and the immune response. That's where the second booster comes in. So in that position, you are really so in with the equipment. You know how the antibody is going to respond. Your body is like, now let's test it.
Okay.
The third phase scenario where you actually get a real opponent or a real
You're already ready.
you're ready.
Okay.
You're ready for the action.
So that's
I throw you on the ground.
So that's the analogy for vaccines, right?
So
So that means that if but I think the point I'm trying to make is
Do we need the second?
No. Even if people who already had, if they confirm positive COVID-19, some people are asking whether or not if I get COVID, do I have to get vaccinated? And the evidence and the popular thinking and the consensus is that it's much. We do not know how long the immunity may last, so therefore you should get vaccinated anyway, even if you had COVID-19.
You don't. You just want to play this. You don't want to take chances like that. And another thing. So even with vaccination, as high as the success rate is 95%, 90%. So there's still that 10% or 5% there that you still don't get the full immunity. Just like some of individuals who, when you're working in the hospitals, you need to get your Hep B vaccination stuff. But then after a few years, booster gone. But some people, they still can maintain that.
So it varies from individuals, lah.
Yeah, it's going to be very.
Won't that make it like, you know? Also,
you're
you're saying that because it varies, it's much safer to get vaccinated anyway.
We still
Even
don't know much about our own immune system yet, because it's only 2 months since we got this vaccine. Like my sister just got a second shot
2
of
months since
the vaccines roll out
rollout. Okay.
globally.
Okay.
So Like my sister just got her second shot yesterday in Singapore.
Oh, that's nice.
Yeah.
Congrats. Then, good lah.
So she said, no, so far I feel okay, good, fine.
That's good. All right.
And,
Okay.
and you see that maybe we're going to see like in the next 6 months, or maybe they're going to do a certain sample testing and see how much immunity
You get
has
from
been
the
developed.
left,
Yeah, so
alright.
that's going to be for future discussion. We're going to
Okay.
see whether we, so we cannot even confirm that, look, if someone gets the second booster also, this is going to last for 5 years. Or
Wasn't
eternity.
there an article that said that the immunity,
That is projected.
the
We have to
immunity
see in reality.
may last for about a year or something? But I think they've been
That's-
they've
then
been monitoring, and so far there's been no drop off. You know what I mean? There's no patients that drop off 1 month
Because
after.
it's still too early. It's still too early to look at that.
I would disagree. I think we have enough data, but it's okay. That will be for the next podcast. This one is also another one. The COVID-19 vaccine. This is popular among aunties and uncles. Sorry,
Which one? Which one? Malay, Chinese, Indian?
I'm not going to touch that with a long 10-foot pole. The COVID-19 vaccines will alter your DNA.
No.
Other chance.
As far as we know how the technology works, it's not able to alter the DNA because if you're looking at mRNA, no chance.
Okay.
But if you're looking about DNA, of course, the transcripts goes in. You have to get the whole untailing up and then the ribosomes coming. So there's one perspective that they feel that you can go into the nucleus, but it's not going to, as far as the scientists say at the current information that we have, it does not interact with the DNA. That is
Okay.
kata saintis lah, aku baca report je.
So, okay, these guys we have to wrap up now.
Okay.
Last two chances, okay? I won't touch the pandemic. Last two chances, okay? Number one, will you get vaccinated?
Of course I get vaccinated. I think, like I said earlier, I'm going to actually advocate people to actually vaccinate more when the time comes.
When we are in phase whatever 3 or 2.
Yeah, because see, I think at the moment
But
is
wait, you're phase 1, right?
yeah, phase 1. I wait lah, last minute one lah.
Have you registered?
Not yet.
Will you register?
Of course I register. In fact, I will give the vaccine if I can.
Of course, you're certified. Okay, number 2. So, this last chance to sort of re-clarify what you say, which is again, come back to the most dangerous part of I feel, the video where
Some people find it dangerous, some people don't find it dangerous.
a lot of people. Okay, if
As I said, it's the 5%.
so that statement said, gun to your head. Would you rather have COVID or get the vaccine? Gun to your head. Which one will you choose?
When?
Right, like today, right now, because we're vaccinating people already.
Are you saying
Our Prime Minister is already getting vaccinated.
he can get vaccinated because he's confident with whatever he got, whatever vaccination he got? Like I said again,
The Pfizer
if
thing, like the first one.
if I have enough of data, like I said, I think you just need another few more weeks. You're gonna get enough of data coming out today.
Okay.
When that comes out, yes, I'll get the vaccine.
What is the data that will make you? I'm going to take vaccine. What's the thing? What's the magical number or?
I think
words?
we need to look into the risk only. In terms of the side effects.
Side effects.
Well, is there any new side effects or not coming in?
New side effects that are.
Especially
They have never been seen before, or.
A lot of it is more neurological.
Yeah. But you see, the thing is,
Even the Bell's palsy one, I think, it's not even neurological, but I think because of inflammation of lymph nodes, that is causing the palsy.
That could happen, but also again, if I read a study because of researching about Bell's palsy and everything, they said that yes, in the group of people that took the vaccines, there was 4 people who got Bell's palsy. In the group of people who did not take the vaccine, there were also 4 or 5 people who got the Bell's palsy. So not a significant amount of people more people had Bell's palsy in the vaccinated group than in the non-vaccinated, which means that the background incidence of Bell's palsy is that amount.
Meaning
vaccines
to
didn't
say,
cause Bell's palsy.
meaning to say that vaccines didn't cause Bell's palsy. Agreed. For me, it's simple. If it's stated in the docket, it's stated in the docket because I cross-check. Even I brought it here.
I understand. So,
All the other vaccines. typhoid, this, that, and blah, blah, blah.
Okay.
Paresthesia was the one of the things. Anaphylaxis, yes, of course.
Okay, here's my last ditch attempt. Okay, by the way, thank you so much for your time. Right, I know it's not. You must be very busy. Last ditch attempt. Okay, if like we mentioned before that this pandemic is a hoax and people are in on it. Okay, people. Of course, you need a lot of people to be in it. Right. If you feel that it's a hoax, why do you place so much emphasis on what's on the docket? Because they can easily falsify it, and therefore, I'm pulling Dr. Roland into my conspiracy.
Okay, very easy.
Okay, very easy.
I think on that it comes to acts and regulation as a person in a country.
Say again, accent.
And acts and regulation in a country. See, if I'm a practitioner,
Law in the law,
Yeah,
law, acts
yeah.
in the
Acta and peraturan.
Acta and peraturan. Oh,
yes,
okay.
follow that, because
But
I will still be judged on my practice
by the law.
by a person if I initiate any practice or treatment to the person, and if I went against, that's it. Simple as that. Because you see,
So you're protected legally.
yes,
You're-
yeah. See, epidemiologists in Sweden don't believe the lockdown was necessary. Are you going to call them bunch of pricks?
Yeah.
So
but you
one,
see,
one country
but
is
Sweden
making.
has done horribly with the COVID-19. There's I don't know third, fourth wave now.
See, you and I will only look at it on a health perspective. But how many people have traumatic income, financial difficulties?
Sweden?
No, here. Let's
lot.
not look here.
A lot.
Because of decisions of whether having a second round of PKP, they just started the engine like, oh, pump, but look, so much of space being.
So I mean, the lockdown and everything, that's a different subject altogether. I mean, yeah, but I understand where you're coming from. Anyway, we have to wrap up. Thank you so
Okay.
much. I hope to see you again
Sure.
on this podcast. Thank you so much. F is bum. Don't touch. Okay. Thank you very much. Thank you.